Okay, hello everybody, and welcome to our next webinar, Healthy Aging, Empowering Patients and Communities Across the Life Course. This is a topic that's going to affect every single one of us, so this is a really great topic for us and for all of our members to take back to their communities. We can go to the next slide. Everybody, my name is Andrew Spiegel. I am one of the founding board members of the World Patients Alliance. Next slide. I'm currently the board chair, and I'm from the US. We want to remind all of those whose English is not the first language that we have multi-language broadcast through Wordly. There is a link in the chat that's being put in there, and if you click on that link and you put your name in, and you click attend, you select your language that you want, and you can hear and follow along with this webinar in your own language. We have more than 50 languages that we purchase from Wordly, so please use that if English is not your best language. And next slide. So just a very quick overview of the World Patients Alliance. We are the world's largest umbrella organization of patient organizations working across all diseases. We want to make sure that patients have an active role, and patients are the center of all healthcare policy, planning, provision, monitoring of medicines. No fees to join. So if patient organizations would like to join us, go to our website at worldpatientsalliance.org into the members section and put an application in, and the membership committee will review that application. So next slide. We are made up of more than 700 patient organizations, 707 to be exact, and many more that are in the queue in front of the membership committee right now from 138 countries. And as you can see in the bottom, it's a very well diversified organization with organizations all across the world. Next slide. And with that, we have so much to cover today. I'm going to turn it over to our co-founder and CEO, Hussein Jaffrey. Hussein?
Yeah, thank you very much, Andrew. I also welcome you all to WPS webinar on healthy aging. The aim of this webinar is to understand and highlight why healthy aging matters and how patient and communities can play a central role in achieving it. So as populations grow older worldwide, ensuring that people live not only longer, but also healthier lives and become a key global priority. So this webinar brings together aging experts and patient representatives to discuss the challenges and opportunities of aging, share strategies to support well-being across the life course, and to explore community and patient contributions to creating supportive environment for older persons. So the webinar will feature insights on aging itself, healthy aging, and also about the WHO's decade of healthy aging and actions needed to build an inclusive, age-friendly, and resilient health system. So this is the agenda of our webinar. So we have our two plenary speakers. We'll understand what is aging and what are the global trends and challenges and opportunities. And then we'll hear from the World Health Organization about their decade of healthy aging. Then after these two plenary presentations, then we'll move towards the panel discussion, in which we will be joined by patient representatives and community representatives, and then we'll have a discussion on this topic. And then you can also ask questions. We will also take some questions depending upon the time. So if you have any questions, please put them into Q&A box. So not in the chat box, but into Q&A box, so that we can revert to your questions. Next slide, please. So our first plenary speaker is Professor Dr. Asghar Zaidi. He is an associate professional fellow at the Oxford Institute of Population Aging, He has served as professor of social gerontology at National University, and also the professor of international social policy at Southampton, United Kingdom. And since 2012, he has led the research work of the Active Aging Index project for the European Commission and UNECE, and the Global Age Watch Index project for the Help Age International. He has also developed the Wellbeing in Later Life Index for the United Kingdom. And currently, he is the provost at the University of Management and Technology at Lahore. And I now request Professor Zaidi for his presentation on understanding aging, global trends, and challenges and opportunities. So over to you, Dr. Zaidi.
Thank you. Thank you so much. Let me start by thanking Dr. Hussain Jaffrey, Andrew, and Penny to give me this opportunity to talk to all of you and present some work on population aging. What is aging? What are the challenges? Let me share my slides. So share and okay, just. So that's what I would be talking about in simplest terms is what is aging and what are the global trends, and then I will be talking about close to 5 different challenges that we are facing because of this demographic trend, and it's not just challenges, it's not just problems, it's lots of opportunities that this phenomenon is offering to us. So let me start by giving away some messages, some takeaway messages right at the beginning. Population aging is undoubtedly one of the defining global trends of our time, and it brings lots of opportunities and 5 problems that I would challenges that I would point to. Okay, what happens then next? Just a second. So, and let's also be very clear why that population aging is happening. It's actually the successes of our society. We live longer because we have better nutrition, better medical sciences, and our living habits have improved. Our living styles have improved a great deal. Um, so we are living longer. So we're not taking exits as we demographers at times talk about, as and delaying our mortality many years. In addition to that, we also, another success of our society is women's emancipation. So more and more women are having decisions towards their fertility, they are delaying fertility or having less children. So there are less people coming into working age population, more people getting into retirement and staying in retirement for much longer. That's what um, um, population aging is all about. So it requires, if you want to continue with this successes and not become victims of our own success, it requires clear public policy responses from our governments in health policy, in labor market policy, as well as in pension policy. And different countries, as we all know, have varying degrees of urgency with respect to population aging. We know Japan has been talked for a long time, having this challenge and how they dealt with it. And now, more recently, and then North America and European countries, and recently now more and more East Asian countries, in particular China, facing these serious challenge of having a larger share of older population in larger share of older persons in the population. And we have international organizations very active in advising national governments, and very many national governments are actually, to their credit, bringing about lots of reforms. Maybe there more reforms needed to be made, and that's happening. In addition to that, we need not just public policy response, but we need behavioral responses from individuals like you and me. And very obvious is we need to have a better diet and have a better habit of fasting, do more exercise, and be more alert to self-care. And one really seriously positive predictor of good uh, health and in old age is social relations. So I'll be coming back to all of these, but I thought right at the start I give you these takeaway messages. So, what is population aging? As I said, it's about people living longer and and having less babies born. So, as a result of these two phenomena, uh, we observe in our society a rising share of older persons in the total population. And older persons, at times, we say 60 plus to be termed as old, 65 plus termed as old. That's depending upon what indicator you have in mind. Many of us way beyond 65 and still not consider ourselves old. So that's just a statistical definition that we use. And healthy aging, and Matteo would talk in more details, is about maintaining functional ability. This is about, despite intrinsic decline in our intrinsic capacity, as we get older, we get frail, we struggle with uh, diseases. It's about, despite those challenges of old age, healthy aging is about maintaining functional ability and well being as we age. And very often, we are interested in healthy aging of older age groups. So, in this respect, not only we are understanding a phenomenon in our society, but we are changing our focus on functioning. It's not about how old you are, but it's about how you are able to function, how independent life you can live, how could you be self-reliant, and how society doesn't see older age as a stigma, but it's actually you age with societal dignity. So it's a renewed focus away from what was commonly understood to be frailty and disease that comes with age. It's more about independence, self-reliance, dignity, and functioning. So that's how we understand healthy aging, that we take a positive outlook of older persons. So let me give you a snapshot of what global aging population is. I could have included many different types of graphs here, but I wanted to include a very simple graph so that you could get an idea of what is happening. So if you see this graph, the gray graph correspond to 65 and older. And you see that the broken line shows that these are estimates, as good an estimate we can make towards the future. And we see that this graph continue rising, and maybe by 2090, 95, it's sort of becoming plateau. But on the other hand, if we see the age group 0 to 19, it has already hit the plateau, and it would start declining as much as that by 2080, we will have more 65 plus than we will have children. So that's what is the phenomenon of population aging we are observing. So 65 plus share is rising, the size and the share is rising, and by 2020 they will be more than children age, adults age less than 20. What is really standing out is the phenomenon that the growth is fastest amongst those 80 plus. Again, this is a success of the society, and we are happily now in mid 60s can actually look forward to another 25 years of life and plan a whole third phase of my life, because I have this sense that I would be not only living beyond 80, but living in good enough health to be functioning, as we put it, to be self-reliant and independent. So that's what population aging is. Uh, and it is happening all at a very different rate. Um, this indicator, although dependency is not a good word to use because that has negative connotation, that as if everybody 65 plus is dependent, but it's a common indicator used in statistical circles, where we look at number of older persons 65 plus as a proportion of those who are 20 to 64 years old. And if you see this red circle, this is how world used to be in 1960, where we see that close to 10 to 20 persons per older persons per younger persons existed in our society. And then we see the green block, and that tells us that that has risen in 2022. And if we look at the predictions, then by 2020, majority of the countries will have even higher number of older persons as a share to 20 to 64. And this indicator gives us how the demographic structure of our society is changing. And I'm sorry that I continue to use this indicator with the name dependency in it. So aging is occurring all around us, but at a different speeds. The challenge mostly in the forthcoming decades, in the coming decades, will be for those countries which are commonly known as low income countries, less developed countries, because they have also observed this longevity gains, but they don't have the resources to continue retiring people and affording their health care and pensions. But it's not all doom and gloom. Many countries have mutual learnings to draw from policy experiences of other countries who aged before in this, so who experienced population aging prior to other countries. So the world is that we are moving to, or already living in many countries, is that we are living longer, we are healthier, and will have to work longer. And in many countries, already people are working longer than what used to be the case 20, 30 years ago. So life expectancy has increased dramatically. If you see this first graph on the left, you see the bars in total. In many countries, we have close to, on average, we could say four, close to 5 years gained over the last 20 years during the period of 2000 to 19. So this is most remarkable. We gain 5 years in our life over the 20 years period. So, and then if you see the color differences, I hope you could see that in the slides. You see the blue and you see the green, and blue represents in good health. So majority of longevity gains, the life expectancy gains, are actually in good health. So it's not surprising that many of us, and that's the graph on the right side, continue to work even beyond reaching 65, which is a retirement age in many of the countries around the world. So this is the world of population aging, where we're living longer, living healthier, and working longer. And now I have taken liberty to give you very quickly 5 different challenges that we are facing because of this population aging phenomenon. One is this graph that you see rising very sharply. This is the graph of how social care, long-term care expenditure is rising in countries. I think this represents OECD countries, but in some cases, the graph includes other countries as well. So it shows that long-term care is fast rising in that respect. And that's basically more and more of us are living and living beyond 80 plus. 80 plus group is actually the fastest rising demographic group. So it's a lot of burden is falling on the public expenditure, and where welfare states exist, this trend will continue on the upward trajectory. So we need to shift from this whole idea of hospital care to community care. So more and more of us will have to take care of our elderly in the families or communities coming together and thinking of ways that they can provide care at home with the help of community volunteers or workers that are in the community. And we have to think more and more in terms of prevention. So people, despite living longer, will have to have the forms of healthy aging that they could be self-reliant and independent. Another major challenge that is going to be linked with that we need a very trained healthcare workforce, and we don't have enough numbers of nurses, geriatricians to be to be taking care of this rising number of older persons, in particular those aged 80 plus. Challenge two is the fiscal sustainability of pensions. We have high expectations that upon our retirement, we will be offered adequate pensions by the welfare system in which we are living. And given this graph that you see that by 2060, the pension expenditure part would reach close to 10% of the GDP. This is a major amount that will have to be spent on pensions. And in as you understood that population aging is about less babies born and older persons living longer, it's clear that not just that they need more spending during the old age, but less people coming into working age means less people will be contributing to the pot from where pensions are paid. So sustainability would depend a lot on pension policy, how it would be designed, and many countries, especially European countries and East Asian countries, have moved on to the new type of pension policy design that reduces the burden, the public burden on the public purse, and timely reforms are required in many countries. Third challenge: when we will have less of labor because of less fertility, this would have reduced labor supply and possibly affecting our growth potential. So, for instance, if you look at the employment rate on this figure, and if you see 55 to 64, that's the blue graphs, you see that majority of the cases, or on average, you see 50% of the people in that age group are actually employed. So we're missing out on a very potentially productive resource by not having enough employment amongst the age group of 55 to 64. So this needs to improve, and also people need to continue working beyond 65. And if they are working, one of the major challenges or question mark, whether to what extent there is a productivity decline as you grow older and have challenges of old age. My own perspective on this is that there is no proof that productivity declines as we get older. In fact, it's the nature of our productivity that changes. Not enough time to discuss for more detail. Challenge 4: is poverty in old age. It's the last thing anybody wishes to have, is that having lived through and contributed to a system and then end up in poverty in old age. And then if labor market opportunities are not available, then you have actually no way to address reducing poverty risk in old age. Um, so women is in particular, we see women and oldest old in this figure, 76 plus face the highest risk amongst the older persons, and that's largely because of women surviving longer than men, and pension systems not having enough survivors benefits to cater for them. And that's also because of informal employment. Many of the people during their working age did not have a formal employment to contribute to pension system and rely on pension receipts in retirement. And basically, it's a life course phenomenon that broader inequalities during your earlier life leads to higher risk of poverty in old age. So this is my challenge four. And the fifth and the last challenge.
Dr. Zedi, 1 minute more, please.
Okay. This is the fifth and last challenge. This is about ageism, that there are negative stereotypes that affects health and participation of older persons, and that also needs to be dealt with. The societies need to have a much more positive view of older persons aging, and healthy aging can actually provide that sense in the society that older persons are not dependent. Now, challenges to opportunities. I have very little time left, but let me quickly go through them. Aging is predictable. We all know where we are heading, and it's very manageable. We could actually bring about changes in our own behaviors, and public policies could come about and manage this. It's not doom and gloom. So, public policies and behavioral changes can really unlock the potential of and the positive side of these longer lives. And healthy aging is one panacea in that respect, because it's not only benefits individuals but also societies. So there is my advice to all of us. We need to eat natural, non-processed food. So that's the first thing. And wherever you could do fasting, that's really gold dust. Exercise, but be sure to do it moderately. But never sit still. And many of us in old age have that habit that we can't sit still, and that's will contribute to healthy aging. Stay engaged mentally in all matters of life, and that's also really critical. Not sort of have the cognitive retirement, but actually stay engaged, even if it's a matter of grocery shopping and mortgage payment or anything, that your mind should stay engaged. And last but not least, hang out with friends and relatives, because that's one of the strongest predictor of healthy aging. Older persons have high aspirations. They are not just dependent, they are self-reliant, and they want to live fullest life in this third phase of life. Thank you so much.
Thank you very much, Dr. Zedi. Excellent overview. And we now know that the world is aging, and you very rightly emphasize the importance of the communities and the families, the need to, help each other age healthily. So thank you very much for your presentation. Can you please take off your
Okay, stop.
presentation? Yes, you stopped. And Haris, can you put up the other one? So just a second. Yeah, so now I request Dr. Matthias Cesarai from the World Health Organization. He is the scientist and geriatrics and gerontology at the World Health Organization headquarters in Geneva, Switzerland. He is also a professor of geriatrics at the University of Milan. Where he also served as the director of geriatric fellowship program before joining the World Health Organization. And with the World Health Organization, Dr. Sari supported the development of the World Report on Aging and Health. Moreover, Dr. Sari has also been working to support activities aimed at promoting healthy aging and improving care for older people, in particular through the capacity building of health and care workers on the principle of geriatric medicine. So I now request Dr. Sari for his presentation.
Thank you. Thank you, Hussein. Good morning, good afternoon, good evening to everyone. First of all, let me thank the organization for the World Patients Alliance for having invited me in this webinar and to present the work that the WHO has been conducting under the umbrella of the Decade of Healthy Aging. Next slide, please. So in 2020, the United Nations General Assembly declared the decade between 2021 and 2030 as the decade of healthy aging. This represents really a unique opportunity to work together, each one with his personal profile, experience, and background, to transform the world to be a better place to grow older. This is a call for a global collaboration involving, as you can imagine, a very wide spectrum of stakeholders coming from different sectors and different disciplines. This includes governments, includes civil society organizations, includes professionals, academia, institutions, media, private sector, and of course, older persons, their families, and their communities. Next slide, please. It was mentioned before in Dr. Zaidi presentation, the definition that the WHO has provided to healthy aging. Healthy aging is the core of this decade, and it has been defined in 2015 in the World Report on Aging and Health as the process of developing and maintaining functional ability that enables well-being in older age. So let's go through this construct that is based on three different definitions. First of all, functional ability. Functional ability represents the health-related attributes that enable people to be and to do what they have reason to value. So I would say these are somehow our objectives in life, in our daily living. A second concept in the framework of healthy aging is the concept of intrinsic capacity that defines the composite of all the physical and mental capacities of an individual. In other words, these are all the capacities under our skin that allow our organism to function. And then there is the environment, the external world. All the factors that outside of us form the context of our life. From the interaction of intrinsic capacity and the environment where we live, we achieve our functional ability. In other words, our capacities, our biological capacities, reserves interact with the environment, the context surrounding us, and through this interaction, we will be more or less able to achieve our objectives in life. Next slide, please. The Decade of Healthy Aging is based on these three constructs and has an action plan that is structured into four areas of action. So how we can achieve healthy aging for the global population. We can achieve it by targeting these four main pillars. First of all, we need to combat ageism. It was mentioned before by Yashgar in his presentation. Ageism is the stereotype, the prejudice, the discrimination applied to the older person or to the aging process. So we need to change how we think, feel, and act towards age and aging. The second action area in the decade of healthy aging is to work for improving the environment where we live and to make them age-friendly. This means ensuring that communities foster the abilities of older people. The third action area is focused on integrated care. To achieve healthy aging, we also need to work to deliver person-centered integrated care and primary health services responsive to older people. And then the last action area is the work that we need to conduct on long-term care. Please be aware that when we talk about long-term care, the WHO does not talk about the facility, the nursing home, but it talks about the chronic management, the long-term management of chronic conditions that very frequently are present in older persons. In this fourth action area, so the WHO wants to ensure that all the older persons who need long-term care may have access to it. As you can see, the four action areas are presented as four pillars, but in reality, they are very closely interacting with each other and they work together. Next slide, please. Why we need to integrate care? As you may have noticed, up to now, I've not talked about diseases. The approach that the WHO is having in the promotion of healthy aging goes beyond age, goes beyond diseases. It is very focused on capacities and is very designed for promoting care close to where the person lives. Also coming out of the COVID pandemic, we have learned a lot, and we know how the integration of services is critical in order to provide meaningful and efficient responses to persons, especially to older individuals. We want to integrate care because in particular older persons may suffer from the fragmentation of care. And please consider also that care for older persons may not be limited in the health sector, but may find responses and solutions in the social care sector. So we want, as much as possible, an integration of disciplines, sectors, and capacities. We want also to have integration of care because in this context, we have not monodimensional solutions to offer, but we need to work on complexity, on multidisciplinary activities and interventions plan in order to personalize solutions for the individual. We want also to integrate care, to bring care close to where the person lives, promoting and facilitating the so-called aging in place, and also by putting all the critical stakeholders around the table to discuss about the complexity and about the solutions that we can offer to the older person, we may also reduce ageist attitudes that still are affecting health and care workers worldwide. Next slide, please. So in this context, the WHO has been promoting, wants to ensure that all the older persons, all the aging population may have access to a continuum of integrated care over long term, something that may reorient care services in order to be not anymore disease-oriented, but driven by the capacities of the individual in order to promote a personalized response to the real needs and priorities of the person. As you may know, with the transition from acute to chronic diseases at old age, the objective of care may be completely different from some decades ago when the management of the acute condition was the primary objective of care systems. Today, we need to work on different populations with different priorities, different needs, and as it was mentioned before, also with different resources available. Next slide, please. A critical component of this framework resides in the primary health care. We want to develop this program in order to have a preventive approach nested in the activities, and in this context, working at the community level is critical. We need to ensure a full range of quality health services close to where the person lives, close to the community, in order to develop prevention and promotion of health, and at the same time making sure that there is a sustainability in the actions that we may propose. There is a sort of decentralization of care in order to provide more responsive solutions to the individual. Next slide, please. I was mentioning before the capacities of the individual that becomes target of intervention when impaired. In this context, the WHO has proposed the so-called ICOPE approach that is based on the identification of needs based on the impairment of different capacities of the organism, a geriatric syndrome as urinary incontinence, and also looking at the critical components in the social part of care that are impacting healthy aging for the older person. In this ICOPE approach, the individual in primary care is evaluated with very simple tools in order to identify mobility limitation, undernutrition, vision impairment, hearing loss, cognitive impairment, depressive symptoms, as I was mentioning before, urinary incontinence, as well as caregiver needs and social care and support needs. Again, there are no diseases here. There is not the age of the individual, but there are some critical components of the well-being of the person that become the entry door in the approach to the individual, implying what? Implying that I cannot deliver high-quality care for a disease if I'm not sure about the cognitive status of the individual, about the sustainability of the social network around the individual, about the capacity of moving, hearing, following our instructions. So the first approach in this model is to look at the capacity and the social network of the individual in order to first target these eventual impairments and potentially reverse them. And in order then to personalize interventions that will then include the management of the disease that may also represent one of the risk factors, contributors to the impairment of capacities. Next slide, please. In this context, the WHO has developed multiple documents. Here you can, through the QR code, you can land on the web page where all of these documents have been gathered. There are guidelines for driving interventions at the primary care and community level by health and care workers. There is a documented driving service and system managers on how this reorientation of care from the disease towards a capacity-driven approach can be developed. There are results from pilot studies that have been conducted in different countries around the world. There is a handbook specifically devoted to build these capacities in health and care workers in primary care. And there is also training material that we have been publishing and disseminating across countries in order to develop this capacity building in the health and care workforce. Next slide, please. This is just to mention that we are looking, of course, at older persons, but we want also to follow a life course approach in the management of age-related conditions. In this context, it was published this year, this document, a framework to implement a life course approach into practice, because we want to ensure that everyone is in the position of experiencing healthy aging across all the different age phases. And as it was mentioned before by Dr. Ashka at the end of his presentation, there are plenty of activities that we can implement in terms of lifestyle modifications that can improve the trajectory of our aging experience and allow us to experience healthy aging and well-being at old age. And all this is, of course, beneficial for the individual, for our families and communities, and will surely support the sustainability of our healthcare systems that are burdened by the very rapid aging of our population. Next slides, and this is my conclusion. So the sustainability of care systems is today challenged by the growing number and complexity of older persons. Older persons today are much older than a few decades ago, with different profiles, clinical and social profiles, and we need to change the way in which we approach this population, providing different solutions. In this context, we need to reorient care services. Please be aware, we don't want to start new systems. We do not start from scratch. We want to reorient, we want to take benefit of what is already in place and just introduce a different way of looking at the person in order also to ensure a human right-based principle of care, providing dignity in the management of care for the aging population. In this context, the WHO has published different documents on how to integrate care, imply multidisciplinarity, comprehensive assessment, and personalization of care, especially at primary care and community level. The work is ongoing. We are in the middle of the decade of healthy aging, and as I was mentioning before, this is a global collaborative initiative declared by the United Nations, and every one of us should play a role in it. Next slide, and thanks a lot for your attention.
Thank you very much, Matteo, for your excellent presentation and informing us about the WTO initiative. Now, we just have about less than 15 minutes left, so let's move to the panel discussion. Next slide. Next slide. Yeah, next slide, please. Yeah. So now I would like to request, two of our panelists who will join our esteemed speakers. So the first one is Ms. Katrina Bozanis. Katrina is the Director of Policy and Advocacy at the International Federation of Aging, where she leads the global efforts to drive policies and partnership that foster healthy aging and advance the rights and well-being of current and future older people. Next slide. And then we also have Penny Covan. She is the Secretary and the Founding Director of the World Patient Alliance. She has vast experience of over 40 years being a patient advocate, both nationally and globally. And in 1980, Penny founded and became the CEO of the Chronic Pain Association. So I thank all of the speakers and panelists, welcome you to this discussion. Since we do not have, a lot of time left, so I would request, I will ask question and request speakers if they can, as briefly as possible, if they can provide the answers, maybe just take a minute for each of the answers. So let me, start with the speakers first. So Dr. Zaidi, if population aging is largely the result of social progress, why do we so often frame it as a problem rather than a shared success? Are we becoming victim of our own success? You're mute, Dr. Zaidi.
Excellent question. I think we should never call it a problem. We should call it a challenge. A challenge will become a problem if we do not bring about public policy reforms or behavioral changes. So it should never be called a problem. In fact, the way I pitch it, it's the successes of our society. We are living longer, and that's a great success of our society. We should be celebrating it. And we give more choice to women, and if that is leading to lower fertility, then we have to find ways to address that challenge rather than calling it a problem. So it should never be called a problem, in my view.
Yes, thank you, Dr. Zedi. Dr. Matteo, so integrated care is widely seen as essential. So what practical first steps can countries take to overcome this fragmentation between health and the social care for older people?
First of all, we need to run a situation analysis country by country in order to identify which are the needs, the opportunities, the resources available, what is really meaningful for the older person in this country, because we also need to consider the socio-cultural diversity across the globe. Once that this situation analysis is conducted, then we can also start mapping the available resources thinking outside the box, because there is a lot of task shifting activities that we need to consider in order to ensure sustainability, acceptability in this reorientation of care. Then a critical component is for sure the capacity building of the health and care workforce in a broad sense, also including informal, unpaid caregivers that very often play a critical role, especially in low and middle income countries, in the provision of care, long-term care to older person. And then we need to start from the field, looking in pilot studies, small experiences before the scaling up, always monitoring with indicators the progress and advancement in this field. It seems complex, but it is a very clear roadmap that the WHO has been providing with a series of documents that may support this process.
Thank you. So, Katrina, coming to you. So we are at the midpoint of the decade of healthy aging. How can we ensure concrete action from all stakeholders, given competing political priorities and rapid demographic change?
Yeah, thank you so much for the question, and thank you for having me. So at the IFA, our mission is really to drive intersectoral collaboration on healthy aging and longevity. So that intersectoral piece is exactly where we work and exactly what's needed to achieve the aims of the decade. So it's not about only focusing on aging, but it's also realizing that aging is connected to almost every facet of society. So Dr. Sidi and Dr. Cesari really went through this well, but aging is connected to economics. It's connected to social well-being. It's connected to health. And so really that's where some of the many important levers that we need to pull on to advance the aims of the decade over the next 5 years, but also think about what's next, what comes after the decade, and what are we working towards after that.
Yeah, thank you. So, Penny, from your personal experience, how does aging affect daily life in ways that the health systems and policies often overlook?
As somebody who's made that journey into aging, I think that there's a lot of work to be done in it. I think healthcare, as they've said, many of what speakers have said is very true about the lack of healthcare that's out there for the older adults. I think the family is also very important. I'm not sure that governments are looking at the older adults and wondering how do we help them continue the aging process. I mean, long and it's going to happen to everybody, and I think it's a privilege. It's not a problem to be aging and to be able to live longer. But I think there's a combination of many things: your finances, your nutrition, all of those things, that especially the support of your family and friends, which I think is one of the most critical pieces. When it comes to policy, it depends on where you live, what you do, and who's implementing that policy as to how you're really going to be able to, get any benefit from any of that policy. So that's sort of up in the air, and that's my own.
Okay, thank you. So, Dr. Zedi, coming back to you, what poses the greater risk for aging societies? Higher spending on older people or failing to invest early in conditions that support healthy aging across the life course?
I think Matthew made a great case that we should not, in all our understanding of aging and older persons, we should not restrict it to a single phase of life. Many of the things that we observe, experience in older ages are experiences of the past. So it's no one or the other. We have to improve upon living experiences so that we could become better in active and healthy aging. And even if we say we miss the boat of not having a great experience earlier in life course, we have to then find a way to continue helping those who are vulnerable in old age. One example is very often women were expected to be homemakers, and they did not contribute in their own right for pension accumulation. So the system in old age, although they were under they were disadvantaged with respect to pension accumulation, but the systems in old age should then compensate for that service women provided for their families and for the society as a whole. So it has to be not sort of a trade-off whether to spend on children and younger generation or to older persons. We have to find a good balance that all this is a very, what Penny was saying, what Katrina was saying, it's very intersectoral. In the same way, it's all of these phases of life are very much connected.
Thank you. So, Matu, coming down to you, the ICOPE approach addresses mobility, cognition, and nutrition. How can these interventions be realistically implemented in low resource settings?
Yes, thank you for Hussein for this question. Actually, this is one of the major challenges because time is always limited in the provision of care, in the delivery of care. And when we start telling people, to health and care workers, that we need to look at other aspects beyond the disease, that the time constraints become a major issue. But still, by task shifting, so involving other actors in the care delivery. And so the medical doctor should not be the only one providing care, but some activities can be delegated to, for example, community health workers, to other non-clinical persons that are specifically trained for a specific task, may facilitate the allocation of resources and time. And at the same time, there is also the need of using simple instruments, questions, contextualized to the purpose and the context. In this way, we will facilitate the introduction of capacities in the clinical assessment of the individual, providing also opportunities for intervening in the early detection and management of impairments. In other words, I've seen also a question about this in the chat, how hospitals can promote beyond diseases. I would ask, how can I treat in an efficient way a disease if I'm not aware about the capacities and resources of the person? We need to include these domains in the new clinical assessment because these are critical in front of the complexity of the older person that very often is not burdened by one single disease, but by multiple interacting conditions and social issues that may further complicate the management of the case.
Thank you. And coming down to you, Katrina, which policies or practical initiatives stand out as strong models for healthy aging, and what key lessons should decision makers take from them?
Yeah, for sure. I think there's I mean, there's many. If you want to kind of look at the national level, but look at the regional level of countries that are starting to support healthy aging. I always think about some of the policies in Singapore on integrated care, and you look at their health system, and obviously every health system is unique to its population, but I always, think about them as having such great kind of integrated care models in terms of the focus on prevention, but also how they're able to support looking at healthcare very holistically. There's quite a few. Matteo mentioned, obviously, one of the key aspects of the decade is age-friendly cities and communities. There's a global network of age-friendly cities and communities, which of course has many different practices in terms of how cities and communities are actually supporting healthy aging and creating environments that are not only good for older people, that are good for everybody. So I would point to those as two models, but there's so many, and obviously it's about taking some good models and good policy and practice and adapting it to different contexts.
Thank you. Penny, let's talk about two very important issues. One is nutrition, and the other one is sleep. I think these are the both two factors that are extremely important for people to age healthily. So what adjustment should, these two things, may people make to stay healthy?
Yeah, I think especially when it comes to nutrition, as we age, our body changes very much, and a lot of the vitamins and nutrition that we typically would get and our body would be able to sustain doesn't happen anymore. So we need to have an open relationship with our care provider, our healthcare provider, to help us understand what we maybe as supplements or how we need to change our diets. It's not something that we know. We don't understand it. Blood tests, all of those are going to tell us over a period of time, what we do need. So I think nutrition is very important. I think sleep is always a key. And as we get older, it's harder to sleep. I can attest to that one. We don't sleep as long. We don't need as much sleep. I think activity may contribute to that a little bit. I think as the one speaker said, don't just sit. You need to stay active. You need to continue to move. We decondition very quickly. So when it to sleep, it's something that, you say they need at least, and I think I've been told, try to get at least 5 to 6 hours. When as an older adult, we do not need as much, but these are key elements: nutrition, sleep. And again, I can't impress upon enough about the support system that we build over our lifetime to really help us age gracefully and have a better quality of life.
Thanks, Penny. So we are already 2 minutes up the webinar time, but there's so many questions that have come in from the participants, and it might not be even I might not be able to take all the questions, but there are a few which stand out. So let me ask about the pension system or the social system that's there. So especially talking about the developing countries where the such system do not exist. So how do you expect an older person to keep healthy, stay healthy while not having these pension or the support available as far as the finances are concerned? So Dr. Asgar or Matthew, any one of you want to take this one?
Matthew, you want to take it? Or? It's a challenge. It's a challenge of population aging in less developed countries. And that's why one of my slides I included the fact that many countries are aging without being wealthy. The systems are weak, welfare systems are weak. Even when people are able to save during their working life, there's not enough good systems to help them accumulate for their older ages. Of course, many older persons have their own mechanisms to save for later life. And for instance, in Pakistan, you see many older persons actually relying on the business that they have developed over their working life, and then from that continue to draw. And that's another form of their savings for their pension. So the real challenge now lies with the developing countries, how they would go about me addressing that challenge. And Matteo said briefly about prevention. Preventive measures would actually be much more effective, and community-based care would be much more affordable than the type of systems that exist in developed countries.
Right. Coming down to you, Katrina, the same question about this financial disparity and how elderly can survive in developing and low resource settings. So what is International Federation on Aging? What's your take on that? And are there any kind of initiatives from your end on this?
Yeah, no, I think it's a great question, and you do have the case where you have many countries that are aging as they are developing. And so this is and they're the countries that are aging the most rapidly in the world. So the places that are, actually going to undergo demographic shift much faster than we saw in Europe or in Asia. And so really there's an opportunity, I think. You have an opportunity to build systems and not fall into the same problems that we might see in other parts of the world, like Europe or North America, where we have health systems that are really based around a sort of cured or a sort of disease focused model. You really have an opportunity to, as Dr. Zaidi said, to position community-based care and prevention at the forefront, and that those are already the strengths in those countries is, have delivering care at the community level. So I think, in terms of what IFA is doing is we are really advocating at the multinational level, but also trickling down to the national level and building capacity at, regions and nations to actually encourage investment in infrastructure that will support, all the things that we've talked about, prevention, healthy aging, support the development of these systems, but also supporting people to stay healthier for longer and maintain in the workforce in order to reap the social and economic benefits of that. So a lot of our work is really, of course, as an international organization at the international level and advocating there, but also trying to bring many different types of stakeholders together to insert aging as as central to their agendas, even if the agenda is vision health or hearing health or things like that. Aging is central to all of that. So that's where a lot of our work lies.
All right. And Matthew, one last question, and it's about individual health. It's about vaccination, the importance of vaccination in adults and older people. So what's your take on this? Are the elderly taking these vaccinations? Is the world overall taking these vaccinations? And what is WHO doing about it?
So vaccinations represent a critical interventions for modifying the trajectories of aging. I'm not limiting vaccinations to older persons, but also looking at the benefits of vaccinations in children. Vaccinations are critical. We need to consider the older persons very often goes completely neglected. There is a problem in health literacy. There is a problem in the access to care. Many older persons are completely invisible to the system. They may live in rural areas, isolation, and these are challenges that we need to start considering a more structured way in our way of working the delivery of quality care for the aging populations worldwide. The vulnerabilities of the individual here play a critical role. If you think that the definition of healthy aging is based also on the concept of environment, it means that we need also to look at the environmental barriers that are preventing access to critical resources for the well-being of the individual. And for sure, there is a lot to do, but I would not even limit to vaccinations, but to access of care in general, and how research is also conducted. Because very often older persons, for example, are excluded from research activities because too complex, they may not follow research protocols, and automatically the evidence that is generated by research activities is not representative of what is the real life population out there.
Yeah, thank you. So we are kind of already 10 minutes above our time, so we won't be able to take more questions. But if any one of you, the participants, have any questions that you would like our speakers and panelists to answer, please do send us by email, and we'll get those answers. I think the world is aging, and I think it's aging quite fast. And as the time passes, I think there will be more and more elderly. Some countries have a negative growth rate. That means, they're not new children that are coming in, but the people have, they are aging. They're still there. So I think we, as a patient and a community organization, I think also needs to do a bit more, because I think globally the focus is on younger people and children and on all of those things. But I think we are kind of been ignoring. I'm talking about everybody, the aging populations, and I'm grateful to our speakers for really highlighting this issue, very important issues today. I'm extremely grateful, Dr. Zaidi, for your very kind, introduction, overview, providing an overview of the healthy aging. Matteo, for telling us about, what WHO is doing and how member states are now, what are the frameworks and what are the initiatives they are coming up with. Thanks, Katrina, for highlighting about the good work that International Federation of Aging is doing. And Penny, thank you very much as always. I know it's so early for you in California, but thanks for your time, and also thanks for your experience of now experiencing healthy aging or aging at this and nowadays. So I thank all the participants, I thank all the speakers, but I let you know that this is not just going to be one of a webinar. I think aging is something that we really need to work more on. So please stay connected, stay afloat. We will be having more discussions of such discussions, more trainings, and more initiatives from World Patient Alliance on healthy aging. So thank you very much to all of you for your participation.
Thank you.
Thank you.
Thank
Thank
you.
you.
Bye.
Good to meet you all. All the
Bye.
best.
Bye.
Bye.